At the first time before he was born, we were told there was a high chance that he would need surgery. We hoped that might not happen, but when they scanned him when he was, I think, 2 days old, they confirmed that he did have coarctation of the aorta and he would need surgery. So we kind of expected it, and I think at that point we were okay. I think we'd been given all the information that we needed. There was a big part of me that worried I might not bring my baby home from the hospital, but we just accepted it. So it was kind of, we don't really have a choice. So I don't actually think the first surgery was as hard, maybe looking back on it, as the others, but then the surgeries that he's had since were almost a little bit more of a surprise, especially the last surgery he had when he was 2.5. And I think that was a lot harder to deal with, wasn't it?
I think for me, I think it's probably different from a father's point of view to a mother's. For me, like you say, the first one, he was 6 days old, it was just part of what had to happen, and it happened, and that was fine, and happily the recovery on that was pretty quick. Again, at 5 months, he was still just a little baby, and for me at that age, you kind of love a baby because they're your baby. Whereas when he had surgery at 2.5, it was very different. Taking a little boy who you can communicate with and talk to into hospital and handing him over knowing that that's what he was about to go through. And for where Evan is, all his surgeries have been proactive and not reactive. So he's not actually been poorly. It's not been to make him better, as you could sort of see. So to take him along when he's seemingly fine, to have to go through that was very hard when he was older. Much, much harder than when he was a baby.
Being told that Harry needed surgery, I think, was one of the hardest messages that we've ever been told about anything. It's a very surreal experience, trying to comprehend that information. Nobody had thought that Harry had needed surgery, so it completely blew our worlds apart. And to be told that, you know, he's 9 days old and he needed it in 2 days' time was just, just very out of body experience. And when they're babies, I think it doesn't get easier as they get older because they understand the situation themselves. And for you have to be brave because you see them being so brave. And that's really tough because they just seem to accept it and they just manage it and they deal with it. And it's just a huge amount of just pride and respect and love that you have for them. But just to see them going through that when they're older, that doesn't get any easier.
Being told that your baby would need surgery and the sort of surgery that she would need, devastating. It's upsetting, isn't it? Because you don't understand. It's quite a serious operation, and knowing that she's going to not just need one of them, she's going to need 3 of them to get her to where she needed to be. To sort of prolong her life, because that's what the surgeries are for. They're all to prolong her life.
When we found out that Cameron was going to be having his surgery, it's just the worst thing ever. And you know that he has to have it, but it's the scariest and hardest thing I've ever had to do as a parent.
Well, being told that Lila needed surgery was a shock, but everything was a shock, to be honest, because we'd just been told she'd been in heart failure, and then we were told that she'd need surgery. I just remember it being really horrible. I don't know if you remember that moment.
Yeah, but I mean, I remember it more from when we went to the hospital, like the second hospital, when we were in Evelina, and they said, you know, she's going to go for surgery, like that morning, where we weren't sure when it was going to be, and that was for me when it became sort of devastating, really. That was the moment that you probably think, if you're going to lose her, it's probably going to be in surgery, if anything. But so that was probably the worst moment.
But we knew we didn't have a choice because she was in such a critical condition that we had to. You just left with, it is a horrible situation. You don't want your child to do that, but then you have to just.
We got no choice.
No, you had no choice at all, and you really just have to put all your, confidence in the team at, the hospital.
I think the build-up to surgery day is always quite hard because, for a start, you don't know whether it's definitely going to go ahead. Sometimes cancellations are out of your hand because there's a much sicker child. So you kind of prepare for it as well as you can, organise your childcare, pack your bags, make sure you're fully prepared for a stay in hospital that could be hopefully just a few days or could potentially be a lot longer. We prepared Sam as much as we could, talked to him about what was happening and where we were going, spoke to family and friends, spoke to work, kind of explained to them what was going to happen. And then with Evan, I think as he's got older, I mean, his last surgery when he was 2.5, we kind of had explained to him that he needed to have this happen and that he needed to have this surgery. And I mean, I can't remember how much he got of it or how much
I don't think he would have understood much, but he appreciated that throughout his life he had gone to hospital for various things, and this was just something else he was going to hospital for, and actually this time he was staying for a little bit longer. He's quite, bless him, he's quite accepting of that, just as it's part of his life. He's used to, he's always gone to hospital for different scans and so on. He's had other conditions like kidney reflux that have meant he's had other scans and seen other doctors as well. So it has, unfortunately, for him been quite normal, which actually, in some ways, I guess, has helped him that he goes in and has that.
For Harry, so Harry has had 5 open heart surgeries, and I think preparing for all of them, each one is probably different just because of the ages he was or is, and when they're little you use the distractions and you keep them busy, so you keep yourself busy, and when they get older it's helping them prepare for that surgery and what they're about to embark on, really. And we tried to have a routine. He had his first 3 surgeries at Herfield Hospital and his last 2 at Brompton Hospital. But we would take ourselves during the actual operation, once we knew Harry was in theatre, we took ourselves out of the hospital, and we were told to do that. And it feels odd because you feel guilty, but actually just to sit around in hospital and watch the clock go round is very, very long time. So we would take ourselves away, try and distract ourselves as much as possible, but make sure that we were back in that hospital just to feel closer to them nearer the time.
I don't really think that there was any way that I could prepare myself for surgery. A part of it just, I sort of wanted to forget what was going to happen and just sort of take it as it comes and see what happened on the day and not really think too much about what was going to happen.
To prepare for the surgery day, we didn't actually have a lot of time. We got a phone call on the Wednesday and we were to take him in on the Sunday, so it was quite quick. We were just making sure that we'd got the right sort of, I remember getting stressed thinking he needed open fronted pyjamas for afterwards, and just then try to sort out who was going to look after Lydia. And it was all just a bit of a blur, and it was kind of like just needed to get the surgery out of the way because we knew it had to happen, and it was just, I want to just get it out of the way and get on the road to recovery.
In terms of making sure you're fully prepared, for us, we're quite lucky that we live fairly close to LGI, and so it wasn't sort of a big move. We didn't have to pack everything because we were a sort of a 15-minute drive away back from home, so that for us is very helpful. I think making sure, like you said before, making sure the childcare's in place so that you're not worrying about your other child or other children and who's looking after them, and just we had your mum and dad helping and my dad helping looking after Sam, and that just left us with one less thing to worry about. You know, the rest of your life carries on in the background, doesn't it? So if you can make sure everything's organised and taken care of, that's pretty important, and then your worry is solely focused on the surgery in hand.
So looking back and thinking, is there anything we'd have done differently? I don't think there was. I don't think there is anything. That you just do what you have to do at the time and what feels right. I don't think there is a wrong or a right way to deal with it. It's just very dependent on how you are and how you're feeling and how they are. So yeah, there's nothing we would change.
I don't know anything that really necessarily would help. I mean, one of the differences now is that what I do find useful is that I'm on like the Tiny Tickers parent forum and things, and that's really good. It's quite a good site because you see, you get to interact with other parents and hear their experiences, and it's nice having that support, whereas going back even to Cameron's last surgery, which was about 7 years ago, there wasn't the same resources there, the same information.
Looking back, if there was anything that could have helped us at that time, perhaps I thought if even just a leaflet or something, just to say, well, this is what's actually going to happen, because when you're told by the surgeons, what's about to happen, it's so fast that sort of 5 minutes later you don't really know what's actually going to happen. So it'd be nice just to have a little leaflet or something, just to say this is what's going to happen, and and who to contact as well, and and the things like Tiny Ticker's number and website on there, but we didn't have any of that at the time.
And like everybody's name, because you came into contact with so many lovely people and you just can't remember their names and who's who and what was the surgeon called and what was the doctor called, and your mind's a blur. And I think it would have been nice perhaps to have something like that just to refer to, just to know who's who and stuff as well.